Okay, you're live.
John Carpenter's, I've known him for a few months now, but it feels as if I've known him for years. He's a super guy out there in the States, and he's come on board with community health commitment, and he's getting things going. Say himself and Sandy are key people out there for us, and I'd just like to introduce you to John, and John will share a little bit about himself and just how he's seen things happening between the strips and everything else we're doing. Over to you, John, with no crown.
Hey, Colin, thanks for that nice intro. I'm a former bodybuilder, and had a life of health before marriage and children, and now I'm discovering new levels of humility as I come back from a more flabby self than I once was. I've been a follower of natural health more than a practitioner of it in the past, knowing how foods work in the body and so forth. I've been in sales my entire life, and so talking to people and doing webinars such as this, that when that technology became available, all these things are wonderful to use when they work properly. But still, most work gets done belly to belly, knee to knee. And when you come with passion about what it is that you believe in, when it comes to whether it's water technology or whether it's a particular type of a supplement, and the types of food that you eat being whole food, whole grain, non-GMO, non-processed, no fillers, no hidden salt, sugars, fats. Those are the things that we look for when we ourselves are eating. And so when we're talking about how is it that we're doing it to others, when that question's asked, hey, we share what it is we do and what we've done. And so, I'm on a mission. As a matter of fact, I've just started a blogging again after probably a couple of years off on taking myself from where I am to what my goal size is. Going from what I say from 48 to 35 and the journey in between. Just taking the clock backwards. So that's what I'm doing and what I've done. I'm a part of Community Health Commitment because the vision that you had for this, and it's exactly where my heart is, to be able to help people reclaim that part of them that we lose to big food, big pharma, and very, very important, that people understand what they're eating. Most people won't even read a label, much less go to a farmer's market to find fresh vegetables or good fruit, or get grass-fed and finished beef or lamb or chicken or poultry of some sort, or eggs for that matter. Being able to educate people on what that actually does for them. That when you're on a diet, you need to understand that the first three letters in diet is die, and it's never a good plan to be in a place where you are, you just get the yo-yo effect, I guess would be the easiest way to say it. And I've certainly done that in the past, and I have no intention of doing that in the future. I know what to eat, how to eat it, and we're just implementing that now. Is everybody still there?
Yeah, we're still here, John. We've just seen Dave come in there. Dr. Dave Carpenter, can you hear us okay? You're on mute. You'll have to unmute yourself, Dave. It's is it top right?
It's at the top, the very top of the screen.
If you put your cursor at the top of the screen, you'll see the microphone. Second from the left. If you click on that, that will unmute yourself.
Move your cursor to move your cursor to the very top center of the screen, Dave, and then you'll see a person with a plus symbol, and the very next one says mute microphone or unmute microphone.
When it's red, it's muted.
I think he's lost connection because it would normally say his name.
You're still muted, brother. There it goes.
Now he's on.
We can hear you now.
I think we got it. Does that work?
Loud and clear, Dave.
Sorry about that.
You're playing the xylophone. That's multitasking. That's brilliant.
Exactly.
John, you okay if we just introduce Dave here and let him speak? Is that okay?
Absolutely. If you don't care, I'll give a quick intro for him.
Go on then. Sorry, John.
Well, if I may, it's my honor to welcome Dr. Dave Carpenter, who I consider a friend and colleague in this path to health. Dave he brought what was then called Kangen water to the United States from Japan. Wrote a book called Change Your Water, Change Your Life that really opened my eyes to what restructured water can do from a nutritional standpoint, and that coined it, if you will, that water needs to take its rightful place in the nutrition pyramid. So Dave has a natural health practice, naturopathic doctor, and Dave, over to you. Welcome.
Thanks. Sounds like somebody else wants you too.
Yeah, I didn't mute my phone either.
Well, I appreciate the opportunity to just be here with all of you today and to talk a little bit. Colin asked me to speak just a little bit about the power strips and what kind of happened with me with the power strips. It was about June of last year, so almost a year ago. I got a call from an old friend who asked me to take a look, and people call me every day, so I have to admit I was pretty skeptical and a little bit resistant, but he told me that they would help with pain, and honestly, in a holistic arena, pain is a big problem for a lot of people. They don't want to take the drugs. In fact, they hate taking drugs, but they don't know what else to do, and I'm pretty good with acupuncture and things that can help with that, but you can't always be there with that person to help them. So I was interested to look at the technology, and I did. What I saw got me excited. I realized that Dr. Kim, the formulator of these, is doing a lot of things with the quantum physics side that he's not really talking too much about. But as a result, these little crazy 3.5 by 5 inch strips really work amazingly well for people. And I've had just amazing response with patients and friends and family with them, putting them on and just letting them wear them. I've watched people, in fact, we've got a young man down in Missouri, where John's from, who his dad got some for him because he's had scleroderma, to the point that he's had many of his appendages amputated, and circulation was horrible. And one of the things that these power strips do that's so incredibly wonderful is it increases circulation using far infrared. And so he puts these on, and honestly, nothing happened for almost 4 weeks. But at the end of 4 weeks, he started getting circulation back in his fingers and his toes. They didn't have to amputate the 2 that they were planning on amputating at Christmas time, which is a wonderful thing for him. And now is starting to get better and better circulation. The appendages are pinking up. Everybody's just really excited to see that change for him. I've spent about 2 hours on the phone with his medical doctor, who's been supervising this process for 21 years. She's blown away. She wants to know what's going on. So we've got something here with these power strips that I think are pretty darn amazing. And when I've watched things like, even scarring and moles and things disappear after you put a strip on for a period of time, like 30 days of applying them at night, and it looks like somebody's had a facelift. I didn't expect that. I was thinking we had something that was going to deal with pain. I wasn't expecting some of the other things. I'm watching the nutritional component, particularly the marine phytoplankton, and what it's doing by being absorbed through the skin and getting into the bloodstream at such a high level. It's incredible for people with like memory issues, like Alzheimer's and things like that, just as an example. So I'm pretty darn excited about it, and I could spend a lot of time telling you more, but I'll kind of turn it back to you guys, and we can always go back and forth if you have questions.
That's great, Dave. I appreciate that. There was one or two questions came up. We did a little presentation on how they work. Um, with skin conditions, we saw one picture of someone with acne, a child with acne, and then it was clear. What sort of time scale are you looking at, say, for someone's cheek to put a strip on before that turns the condition around?
I think with most things, you're probably looking at 30 days or so, minimum, sometimes 6 weeks. But with acne, it's responding fairly quickly. I had a lady just yesterday with a bad blister on her foot, on the ball of her foot. We cut a strip and put the part of the strip on the ball of her foot, put a little paper tape on it. She called me this morning and said the blister's gone. So sometimes it works really, really fast, too. Moles take about 2, 3, 4 weeks. Warts, a little, about the same. Some of these deeper facial scarring or even like wrinkles, the deeper ones, it's taking a little time, but usually within 30 days or so, we're seeing big differences.
That's fantastic. One of the things we were looking at as well was the when it comes to pain, is it depth? Does it depend on the depth of the pain, the length of time it takes to relieve the pain, or is it more sort of on the surface that the pain is? What's your thoughts on pain and the types of pain and sort of timescales?
Well, pain is an interesting thing when you study it out, and I think everybody's different, and we have to keep that in mind, because you could have 3 people, for example, with the exact same diagnosis, say a degenerative disc disease, for example, and you could put a power strip on each one of them, and the first one may go, gosh, within an hour, pain's reduced 75%. The next one may say, I am not feeling anything, and they could wear it for 2 weeks and not feel anything. Now, not feeling anything doesn't necessarily mean the pain's not going down, actually. With the far infrared attributes that are enhanced because of wearing a power strip, what really is happening is increased circulation and decreased inflammation. So sometimes we're in so much pain we can't really tell where it is, and we're just constantly in pain. But I will tell you that based on about a 10-month, 11-month experience level now with the power strips, everybody will see a reduction in pain, and they will see some healing stimulated if they wear these long enough. But some people, it may take them 3, 4, 5, 6 weeks before it becomes noticeable enough that they can actually determine it for themselves.
That's great. We talked last week about the potential of these strips and the power of them, and just obviously talking about what's coming next with community health commitments, supporting people with these. You were quite positive that some of these conditions, if applied longer than visibly just going away, that they could get down to the root of some of the causes and prevent them coming back.
Well, I think at the bottom of everything, the body is designed to heal itself. And if we give it what it needs in the form of good nutrition and adequate hydration and enough rest, good positive mental attitude, it needs these things, and it needs all of them. You can't just give somebody a nutritional supplement and have them not sleep every night and expect them to get well. It's not going to happen. If they're dehydrated substantially and they're taking the best supplements in the world, they're still not going to be healthy. So it's all about balance, as we all know. But I will tell you, these power strips have some serious power in them. The quantum energies that are programmed into these little crystals for healing and for wellness, I think are vast. And when you add to that increased circulation, and if you haven't seen the thermography pictures of the power strips, you need to go watch the video just to see the impact, because you can put one of these at the belt line and have an impact up near the neck, down below the knees. That's a big deal. And then when you start looking at, there's a couple of aspects to these that I wouldn't talk to large groups about. necessarily because they may get a little in over their head. But what I will say is, think about this. You've got marine phytoplankton, which is the superfood of all of the great whales and everything. It's 100% available to the body, gets into the bloodstream, and then on top of that, you've got all of these quantum energy vibrations, let's call them, that are impacting the water in your body. And I don't know if you've thought about that, but when you're 70% water or more as an adult, and you put substantial vibrations 24/7 through that water holds those vibrations. And it has a huge impact on healing, just like having somebody walk up and give you a hug or praying over you or anything else. There's a huge benefit here, I guess, is what I'm trying to say, that I don't even think we can measure, and we probably will never be able to fully measure and understand.
That's fantastic. I'm looking forward to finding out what locations people are putting strips on for best effects. As you say, things are going to react differently with different people, but I'm sure over a period of time we'll find out the best locations to put for different conditions, whether it's migraines or back pain, etc., etc. You know, just now they say strip it where it hurts, you know, put it on where it hurts. So I suppose that's the general rule to follow, is you've got to go as close to the source of the pain as possible. Is that correct?
Yeah, I would say that the real answer probably is get it close to the pain area on a muscle rather than on something that has mostly bone. Like if you have knee pain, don't put it on your kneecap, put it on the muscle above the kneecap. If that makes sense.
Yeah, that's fantastic. That's raised one or two eyebrows here. That's great. I'm just going to see if anybody else has any questions.
Okay.
Hay fever. The effects with hay fever. Where would you strip it? And have you experienced any effects with allergies and hay fever?
Well, allergies, of course, are caused more from an immune system function or imbalance. So what's going to happen is the power strips do contain, and the silver will help the immune system as part of that. And then there's the adaptogen ginseng, red Korean ginseng, which is also going to be very beneficial. I think with allergies, the first thing I will always tell people is start drinking more water. They're not drinking enough water. That's the very first thing. But as far as putting the power strip on, the best place that I've found so far for allergies is directly over the thymus area, right here on the chest. If they'll put a power strip there, that seems to have the most effect on the immune system.
That's fantastic. One thing I did notice, and I haven't put on one chest, but on my legs, and for peeling off with hair isn't an issue at all. You know, I was worried it was going to be like rip, you know, terrifying. But no, it came off very easy. You know, I'm just going to open it up if anybody else has any questions. Any questions?
I've had someone come. Someone asked the question. He has a collapsed disc, which is pressing against the sciatic nerve.
Right.
And he's wondering, because the disc is collapsed, will the strips help it?
Dave, did you hear that?
I think they want to know about a collapsed disc. Will the strips help?
Yeah.
Was that pretty much the question?
It's collapsed. The disc is collapsed and it's touching the sciatic nerve.
Okay. Well, it's not going to cause that collapsed disc to immediately be whole again, so I don't want to mislead anybody.
Right.
But what it will do immediately is increase circulation, which allows more blood flow to that collapsed disc, getting it more of the nutritional components it needs to repair itself. It will also reduce the amount of inflammation almost instantly. It's within minutes, and a lot of times with that type of a problem, it's fairly quick relief. Now, it's not 100%. Let's say that 10 is the worst pain that you've ever had with that problem, and you're at a 10. It may only bring it down to a 6 or a 6.5, but that's substantial in a short amount of time. I mean, it makes it at least livable for a little while as the body is healing itself. The best thing, again, to do there usually is to put it as close to the area where the problem is. If the pain is down in the lumbar area, put it where the lumbar area is. Put it where the pain is. And there's one issue with men that have hairy backs particularly. Sometimes we need to shave the back and just to make them adhere. The other issue, of course, is that sometimes we have quite an indentation down the spinal column, and sometimes you have to have a little help to really get those down there and keep them sticking, or else put them to just one side of the spine, more in a up and down, and rather than covering the bone itself, just put it right to the side of it. Sometimes they'll stick a lot better that way.
That's fantastic. Helen, Alison, have you any questions at all?
Hello, just taking ourselves off mute. I've been asked by a lady who's got poor circulation in her feet whether there would be any benefit of putting the strip, halving the strip, and putting it on the soles of her feet.
Absolutely. I use these with neuropathy all the time, and a lot of times what I've done, it depends on the person and what they wear as far as shoes. Some people with neuropathy and circulation in the feet don't like tight shoes, and they wear like flip-flops and things like that. Putting them on the sole of the feet, it makes it hard for them to stay on for very much time. So what we've been doing is cutting them and putting them on the top of the foot. Oh. And again, it penetrates quite a deep amount of tissue. It will still affect the bottom of the foot even from the top. You could even put them on the ankles and get a huge amount of benefit.
Oh, that's really good feedback. Thank you for that.
One of the other things, just real quickly, I'll share is that with things like carpal tunnel, where the hands go numb, we found to cut one strip into 4 small ones and put one on the bottom, on the inside of both wrists, and one on the back side of both wrists. And usually the person will notice something within just a few minutes. That clears the problem up.
Just a little interruption. That's great, Dave. Another question coming from here. After 24 hours, there's a bit of irritation on the ankle. Just around the ankle, there's a bit of irritation after 24 hours. Is that common with the strips, or is maybe something causing that? They're fine for 24 hours, but after the 24-hour period, just a little bit of irritation and a bit itchy.
Well, I think anytime you cover the skin up and don't allow it to breathe like it normally does, there's a potential for irritation. And, you know, no matter how careful you are with the adhesive materials, they're still adhesive materials, and there's a little bit of skin irritation. Some people can wear them for a long time. I happen to be more like this person. I put one on for about 24 hours. I'm ready to take it off and put a new one on somewhere else. But I can wear them. You know, I just don't like them much longer than about 24 hours, or it starts, I find myself doing a little rubbing on the shoulder or the ankle or wherever it might be. So I understand that. I think that's pretty normal.
Right, right. John, have you any questions at all? Always on mute.
Am I there?
Yep, you're there now. Any questions at all?
Yeah, I probably have one question. People have asked me, you know, about showers and so forth, and maybe we could just clear that up with some commentary about it. I know that if I understood it right, I want to make sure I do have it right. The phytoplankton, the nutrients that come from the patch would be washed away, but the patch would still be able to provide heat to the body. Do I understand that right?
Yeah, that's pretty much correct. The little crystals that reflect the far infrared heat are not going to ever leave the strip until it disintegrates. So the showering won't get rid of those, but it will get rid of the nutrition. However, if you wait to shower for about 8 hours, then the nutrition has already left the strip and is in your body, and at that point it doesn't matter. So if you showered in the morning, for example, put a power strip on your back, and then waited until that evening, 8 or 10 hours later, you're really not going to wash anything out. It's already gone. And all you really have to do at that point is just not vigorously dry the power strip, because that'll wrinkle it and usually shred it. If you just kind of pat it, let it dry, they'll stay on there and usually work pretty well for another day or two.
Got it. Thanks,
Shower once a day, John. That's good advice. Now, Dave, just another question. Talking about showering, etc., and is there any sort of best time to put it on? Is it best before you go to your bed to put your first one on, or during the day? Obviously, you're up and moving and whatnot. What would you recommend for someone trying it for the first time to get the best effect?
For the power strip?
Yeah.
Yeah, you could cover that. Like if you wanted to go in a shower you just put the strip on for an hour and you wanted to go in a shower, just put a little bit of like a plastic, saran wrap or something over it and tape it down. You'll be fine.
Sorry, Dave. What I was talking about was for someone to experience the strip for the first time. Would you recommend them to get the best effect is put it on before they go to bed at night, or would you recommend in the morning or any time of the day?
I don't think it matters that much. I think that to get the best effect, you just need to put it on and wear it, knowing that about 25% of the people that put one on are going to notice something within the first hour or so, certainly within the first 24 hours. And the rest of them are probably going to need to wear one more than one day in order to really benefit from it and notice it. So, I think we just have to approach it from that perspective. It's not a drug. Never has been intended to be a drug. It doesn't always work like a drug in that it doesn't immediately deaden the pain. So if somebody's looking for pain relief and it doesn't work immediately, they're probably going to have to wear it for a few days.
That's fantastic. Any last questions from anybody before we let you guys go?
Yeah, I do have a question. Hi there, it's Helen. I've recently had an antioxidant score through a biophotonic scanner, and established that I've got very, very low level of antioxidants in my blood. I'm in the unhealthy red zone, and also sort of from a free radical point of view, that's not particularly healthy either. If the strips have got nutrients in them, if I was to place one somewhere, would that actually help towards my antioxidant levels?
Well, it will help with that. The problem is, and I'm not sure how, what kind of antioxidant testing you were receiving. There's one company, for example, that basically measures beta carotenes. And if you were using that as a test, then you probably wouldn't see any change at all, because there's not a lot of beta carotenes specifically in the phytoplankton. But if you're measuring all antioxidants, then yeah, there would definitely be an improvement in your antioxidant levels.
So from a general health perspective, there's benefits in having a power strip on?
Well, power strips contain marine phytoplankton, which contains all the micronutrients that your body needs. So you can't, unless you're getting those some other way, you can't lose by getting them this way. It's one of those things where you're getting all of those little pieces of the nutrition that you need. I personally, I'm going to wear one every day just because it's convenient. And I still take other supplements. Don't misunderstand me. And I'm still fairly fussy about what I eat. But I just think it's a great way to make sure I don't miss some little micronutrient that I might have been missing. And it gets we know that the phytoplankton is in such a form it gets across the blood-brain barrier. So now my brain's not being left little missing of certain elements that it might be needing as well. So.
And am I correct in understanding that the body is in a healthier disposition if it's on the alkaline level, and that the phytoplankton can help the body turn from an acidic point of view to an alkaline?
Well, that's absolutely true. Although, I would have to say that if you wear a power strip and you're doing a lot of acidifying things, whether it be really negative thinking or whether it be drinking sodas all day long, for example, the power strip can't make up for those kinds of things. So I don't want to mislead anybody, but it certainly can be very beneficial for helping the body that's already doing other things to enhance the alkaline aspect of it at that point.
Excellent. Thank you.
Dave, I've got a question here from one of the audience. In joined up writing, I'll try and read it out to you.
Okay.
What is the optimal length of time to leave a strip on before replacing it as a diabetic?
Well, the best answer is that you would replace your strip every 24 hours as a diabetic, because diabetes, in my opinion, is it's a wasting disease. It's a nutritional wasting disease that we don't really talk about that aspect, but diabetics are not getting the nutrition to the extremities in particular like they need to. But let me back up and qualify that and say this. I give this advice to patients all the time. If you have pain or you have circulation problems, take full advantage of the power strip and leave it on for 24 to 48 hours. If you can stand it on your skin for 48 hours, leave it on. But that doesn't mean you couldn't put a new strip on the very next day. So what I would recommend for some people, especially people that have like neuropathy in the feet, just as an example, is they put one on the left ankle or half of one on each ankle. They cut it in half on day one, and then on day two, do the same thing, but leave that one on, but put a new one on and maybe cut it in half and put it on the front of the ankle. Now you've got two strips actually that you're wearing, but one of them is not putting nutrition in the body. One of them is just increasing circulation and helping with far infrared promotion. The other one is giving you the same benefit and adding additional nutritional components. And I think that's a way to optimize them and get your money's, the biggest bang for your buck, let's say it that way.
That's fantastic. I think here in Scotland, just being Scottish, we'll have them on for maybe 49 hours, you know, just to get our money's worth out of them. No, that's fantastic. Another question that just come in there. Asthma sufferers. Where's the best place for asthma sufferers to put the strip on, and what's the effects on them?
Asthma?
Yeah.
Like respiratory? Okay.
Yeah, that's right.
Well, the effect is that what happens that basically causes asthma, by the way, is dehydration at a chronic level. So then what happens is the body is, it's basically promoting histamine. I don't want to get into a chemistry lesson here, but basically the body makes this thing called histamine, and histamine causes the restriction in the bronchioles particularly, so they don't allow more water loss. So then what happens is they swell up, you start having a hard time breathing, and if you're not fixing the water loss problem, and you go to the doctor, typically what happens is this. They will give you an antihistamine to reduce the swelling in the bronchioles. That will make your breathing easier, but you didn't fix the hydration issue. So now the body makes more histamine than ever, and you just have to keep going back for a bigger dose of antihistamine. So as far as the power strips go, if you don't change the issue that's taking place chronically at the fundamental level of dehydration, it's still going to be helpful, because as you put them over the chest area again, you're going to get increased circulation, which will help the body hang on to the hydration, and it will actually increase the circulation and blood flow to the lungs, making them more efficient. So the symptoms will reduce some, But in either case, you haven't fixed the real underlying problem, which is go drink more water. And if you can do both, magic will happen.
Yeah, yeah. That's fantastic. I really appreciate your time. That's amazing. Just some simple advice there. I'm looking forward to getting together and talking about water on another occasion. But if there's any one final question, we'll let these guys go. Anybody on screen? Anybody? Final question? Silence. Dave, I really appreciate your time. And say, sorry.
Seconds, we've got a question.
We've spoken about, you know, how veins can open up, you know,
Yeah.
with the use of these strips. Are they to be used in conjunction with statins, or?
Good question. Can the strips be used in conjunction with statins?
Absolutely. Absolutely. There's absolutely no risk taking statins along. There's absolutely no risk while you're taking statins to add the power strips in any way. There is risk with the statins themselves. I don't want to mislead anybody, so you need to know what those risks are. But if you're already taking them, don't worry about the power strips. There's really no downside.
That's fantastic. Fantastic. Listen, guys, I appreciate your time here. It's getting on for us as well. We look forward to many more of these meetings on different topics and that. Really appreciate it. Sandy behind the scenes there, pulling all the strings as well. Fantastic. We almost had 4 time zones, but 3 time zones here today, so it's worked out well for everybody, and I appreciate your time, everybody that's come on here. Thanks, guys.
Thank you.
Thank you. Good night.
Bye.
He's doing very well.
Very good.